Good day, everyone, and welcome to Things to Know Right Now. As you may have, if you've been keeping track of us, I am Jo Rosen. I'm the president and founder of Parkinson's Resource Organization. I've been doing this for only 30 years now, and I haven't learned everything, so I have to keep going. But we're in a time right now with COVID-19 going on. We have a lot of new conditions, a lot of things that we need to talk about. We're going to talk to someone who really has to be concerned about COVID-19 in her practice. But what we're here today to find out more about is TMJ and the way that temporomandibular joint disorder might be misdiagnosed as Parkinson's, would be one idea. Or, well, this is what we're going to find out today, because I'm going to introduce you to Dr. Maryam Bakhtiyari, who is a dentist who happens to know a tremendous amount about temporomandibular disorder. She has her doctorate or several doctorates in this. She has closed her practice to everything else other than TMJ disorder, and she otherwise was an orthodontist. And I just think she is incredible, and you will too, because once she gets the information that we're going to ask about to you, you'll just love her. So tell us about what type of doctor you are beyond what I just explained.
Hi, everybody. My name is Maryam Bakhtiyari, and I'm a general dentist. And my practice is limited to temporomandibular joint disorder, sleep apnea, and we also do orthodontics. And I came about to the world of TMJ about 26 years ago, where I had patients that had TMJ and I didn't know what to do. As general dentists, when you come from dental school, there's not much education on TMJ. So that was my beginning of my journey in 1993 to start learning more and more about the big fathers of TMJ. And I was lucky to be trained by Dr. Witzig, and just it goes on to Brandon Stack. And we now know that a lot of our ailments, health-wise, is related to this disorder. And a lot of the neurologists and doctors that we work with, we have to train them and teach them about TMJ. It seems like that was also marked off in medical school. So that's where I am. I work with a lot of medical issues, and I call myself, just like Dr. Alfonder in his book, dental physician, because as dentists, we can do fillings, but we also are working in a very strategic place in our face. And I'm going to show you a diagram.
Well, so I just want to say that what we'd like to do with Dr. Maryam and others that are doing what she does is we would like to teach neurologists why this little space that she's going to show you is so critically important to good health, and why symptoms of Parkinson's could be misdiagnosed as being TMJ and vice versa. And so go on, Dr. Maryam, if you can show that picture.
Sure. I'm just going to show you a picture that I have in every room in my office, and I had to bring it for the Zoom out. This is just self-explanatory. And as you guys can see, is the major blood supply, nerve, and artery that comes from our carotid area, and all of us know where the carotid is, passes right behind the ear to feed our brain, the back of the head, and facial structure. That little region is very important to stay open and patent so that we have the circulation to feed our brain. In the TMJ patients, usually the lower jaw is slightly pushed back, and it's pinching that neurovasculature to the brain. And thus we get symptoms such as headaches, fogginess in our brain, dizziness, balance issues, ear issues, vertigo. And by this lower jaw push back, we also, since the tongue is attached to the lower jaw, we're also closing the airway back here. If you all know that the back of your throat, when you push the tongue down, you look at your air pipe, that area also becomes compromised and smaller. Therefore, it causes some sleep disorders such as apnea. So by treating the TMJ, what we're doing is we're moving that jaw and putting it in a correct position, non-surgically via an orthotic, opening this pathway and allowing the body to heal.
So just to add to that, so that just shows the blood flow. And so there's another area, and correct me if I'm wrong, but I think that also the trigeminal nerve canal, the nerve that goes, that the instruction from the brain to the rest of the body goes through that little space as well.
So this region right here, it's supposed to be open about 3 to 3.5 millimeters for this neurovasculature, which is the nerve, artery, and vein pass through. The nerve that passes in this region, we call it fifth cranial nerve. And the fifth cranial nerve is very interesting because it's our second biggest sensory nerve in our whole body. If that nerve gets pinched, we have pain sensation. It could be in our knee, in our back, any other part of the body. Because it's sensory nerve, the brain gets confused where it's coming from. And it could be coming from here, but then all of a sudden we have sharp back pain, knee pain. So it is a very important nerve. I feel like it's probably the most important nerve in our body, because through that, you're getting the circulation to the brain, and the brain chemistry is happening. So a lot of times we treat patients with tremor, body tremor, and we know it's the effect of the fifth cranial pathway impingement that may be contributing to that issue. So,
there's so many things that when we start treating the malaligned, if you will, condition of temporomandibular disorder, that many things that have manifested in the wrong way can be corrected. So one of the things you brought up, Dr. Al Fonder, who in 1977 wrote the book called The Dental Physician. Wonderful book. I happen to have one. If you could even get one today, it's over $100. I think I saw one at $400. But thank you. It's The Dental Physician has a picture of when he straightened through the use of orthotics. He straightened someone's spine out, and I mean, it's like, who would have known that posture had something to do with the temporomandibular joint?
So if you look at the spine in his x-rays, shows patients bite correction changes the way your back is. Like on scoliosis cases, he took a before bite correction and after bite correction, and he showed alignments happening. So it's always confusing when patients think, as a dentist, is a dentist treating neurologic disorder? Why is she claiming to treat Parkinson's? We're not claiming any of that. What I see on my daily, day in and out, patients that I just finished my morning session, is patients that come with a lot of the symptoms that are very similar to Parkinson's symptoms. Not necessarily they're diagnosed with Parkinson, but there's a lot of areas of, like, for example, patients' balance issues affected with TMJ. So is Parkinson's patients' balance issue place. They have constipation usually in the morning. So is our sleep patients that have constipation. They usually have speech issues, and so is our patients that are in latest stage of TMJ. So what we found out, not me personally, but doctors like Brandon Stack, I call them the fathers of TMJ. They found out that for even patients with neurologic disorders such as Tourette syndrome, the Tourette syndrome is not the same as Parkinson, but it also affects tremor, that they were able to correct the bite and treat the patients with any type of a tic, whether it's verbal or it is movement disorder with any type of, from neck, head, hands, any type of a movement by bite correction. So we're learning a lot about that fifth cranial pathway. Has so much to do and so much we don't know.
Yes.
And
So I've been so honored. I met Dr. Brendan Stack, and I'm happy that he's happily retired. He's a wonderful, wonderful spirit, a wonderful man, so intelligent and so intellectual along with it. And you keep talking about when we correct the TMJ. What is involved in correcting the TMJ?
so basically on my patients that they come, they have TMJ. A patient comes and it has symptoms of TMJ. We take an x-ray. We confirm that the anatomical region is compromised. And all we do is a non-surgical treatment, which means we make a special splint to move the lower jaw in the correct position, thus relieving. So we basically make an orthotic that goes in the mouth, clear, comfortable, that makes the lower jaw, basically orthopedically pushes the jaw in the correct position, allows the jaw to kind of posture in the right position.
Do you by any chance have an orthotic there? I was going to bring mine today so that I could show and tell it. But
I can get one right now if you give me a second.
Have somebody bring one into you or whatever.
Yes, give me a second while you're talking.
Okay. So for those of you who are listening, know that I don't have Parkinson's, didn't ever have Parkinson's, but I had many of the symptoms that Dr. Maryam is talking about. I started with depression. I started with headaches. I started with a lack of range of motion in my neck. I had a knee pain, and remember in the earlier part of this, she was talking about how you can have pain that actually starts up here, but is actually manifested. Mine was in my knee. It was difficult to walk, and so I went through the process of what she's going to show you in a minute, the orthotic, and we'll talk about how this treatment is conducted a little bit. But I went through that myself, and today I must tell you, the other thing that I did is I would sleep for an hour and a half at a time, and then I would wake up. But that had to do, and I had no idea, that had to do with the apnea that was going on, the sleep apnea. So once I started with my orthotic that Dr. Maryam is going to show you and talk about, I no longer have any of these symptoms. But I also, every year, I go through a maintenance of my orthotics. It's like wearing a pair of shoes. They change in time. So I go in for my reevaluation every year. And it just so happens that Dr. Maryam is my doctor, and I drive 2.5 to 3 hours to get to her. But when it's important for health, that's what we're talking about today. So back to you now with the orthotic.
So this is a lower splint that goes in the mouth, sits on the bottom, clear. Let me see if I got it. Here we go. And it's not invasive. And once the patient put it in, we have anywhere from patients that are younger to lawyers to news anchor people. It does affect the speech a tiny bit, but in reality, you can't see it in their mouth. But by putting it in, immediately the jaw comes in the correct position, changes the posture and spine. Within seconds, the patients feel like, okay, the spine is changed, and it takes time for them to adjust. But then in long term, the symptoms that we're able to help is, one is their headaches. One of the biggest symptoms that we heal is the vertigo and balance. And I think that's a very big part of patients with Parkinson's, because once we take the pressure from the ear, we move the lower jaw forward and the ear is left alone. As we all know, ear has a nerve that is to do with balance. When the jaw is positioned back, it presses on the ear bone and causes the particles to move and creates vertigo. We will be able to leave the ear alone so the patient has balance, they can lift their feet better, they can walk better, they have more energy. At the same time, a lot of my Parkinson patients and my TMJ patients, what they parallel is also they have sleep disorders.
Thank you. I was just going to bring that up. Yes, because there's a device for that.
Yeah, so this device is our premium sleep appliance device. It's called DSAT. It's made in Canada. If you guys see it close by. It's very light, durable. This is a FDA-approved appliance for sleep apnea. once we make this appliance and get them fitted for one, custom made, they will put that on. Now we're treating their apnea, and they wake up in the morning rested, brain is rejuvenated, so we're not constricting that blood supply that I showed you to the head, so there's no atrophy of the brain, and their constipation is gone. So this is the things that they usually suffer, but this is all common to all my TMJ patients. Like, a lot of the symptoms are similar, so all I do is treat their TMJ, and they can mark off a lot of the symptoms that parallels to Parkinson's.
Yes. Okay. So now, just so that everybody doesn't think that they can just walk into a dentist and talk about TMJ, there are dentists who will talk about it, but there are the dentists who are actually trained in this work. It's critically important. I'm going to say this to you. I don't know if Dr. Maryam what she will say after this, but it's critically important that you go to someone who is accredited either by the FAACP or by the CCIMO or one of these organizations where they go way beyond their normal training and are trained in this so-called, I would like to call them, I'd like to give them a new name, and it's going to come out of here if it ever gets done, and they would be called neurodentists. And they would work closely with the movement disorder specialists and the neurologists. I cannot tell you the neurologists who have said, oh my God, this has never been taught to me in medical school. So just need you all to know, but it's not just an overnight situation. So Dr. Maryam, perhaps you could tell us two things. One, how long does it take to go through this process? And two, is it costly? And maybe the third one is it covered by insurance?
Yeah, so usually once the patients are here and we get all the basic imaging and impressions done, the day splint takes about 10 working days. It's made in California. The night splint goes to, if they need it, not everybody also needs a night splint, but if they needed a FDA approved sleep apnea appliance after they are already diagnosed with sleep apnea, and majority of my Parkinson patients already have diagnosis for sleep apnea, that takes about a month to come back from Canada. So the cost, I mean, everything costs. The day splint costs about, here in this office, about $2,800. The night TMJ appliance is a little bit more expensive appliance that if patient has apnea, it's about $7,200. If they have a PPO insurance, it should cover some portion of it, but everybody's different. I have patients from anywhere from Northrop Grumman where they get 100% coverage, and I have patients from Boeing that they get 30% coverage. We fight for them, but if they're Medicare, Medi-Cal, they have to come with their off-pocket, but we also have a fee for them. That's a little bit more affordable. There are those Parkinson's patients that are very at the beginning stages, and they may not need an FDA-approved appliance. They may just have some sleep disorder, not necessarily apnea, and it's an additional $3,100 for a night appliance for them versus, are you here? Versus an FDA-approved sleep appliance. So it is, I always feel like they've gone through so much. This is not any more expensive than everything else done. It's less invasive than doing all this procedures that neurologists do. I am also fortunate that I'm working with a neurologist who's a pediatric and adult neurologist, Dr. Bakhtiyari. She's in South Bay close to me, and we're doing right now a joint research on effects of TMJ with migraine. So we're now taking 33 patients of her migraine patients that we're going to treat with these orthotic to see if they don't need medication anymore, or do they need medication. I've always said they don't, but she wants to see it, so we're doing a merge study. So there are those neurologists that are off the book and off the chart and done more studies.
Going outside the box. Yes.
Outside the box, yeah.
So I will just add to this that, you know, I've said this over and over. People who know me know that I always say, what price health? So if it's not covered by insurance, what do you have to do in order to get this treatment for yourself if this is something that you need? I think there are a couple of things. First of all, you advocate with your insurance company. Between Dr. Bakhtiyari's office and you and the insurance company You should be able to come up with something that is reasonable for you. And then if it's not that, then maybe there's some kind of bartering system that you can use. Or maybe there's, I know Dr. Bakhtiyari has payment plans that you can talk about. But this is your health. You don't get a do-over in health. You don't get to, I mean, this is not a dress rehearsal, as everybody keeps telling all of us. So this is something that if you have TMJ disorder, and it is manifesting in symptoms that are like Parkinson's, and maybe you think you don't have Parkinson's because the meds aren't working right or whatever else, get an assessment. How can it hurt to get the assessment and have the knowledge and then work from there? Parkinson's Resource Organization will help in whatever way we can to teach you how to advocate or to teach you how to get the job done for your health. But Dr. Maryam is only one of, when I got started in this field of TMJ, when I learned about it, it was about 2011, 2012. And I went to all the conventions and every place else that I could go to learn. And in that process, I found out that at that point in 2012, there were probably 500 dentists in the United States that knew what Dr. Maryam is telling you about today. Today, I'm sure there are a few more because there's more notoriety behind it and more information behind it. But I will tell you that there are not that many dentists who are really this involved in temporomandibular disorder. Choosing that dentist is important. You can find several of them in the Wellness Village on our website. I've told you over and over and over, our website is filled with resources. Dr. Maryam is there. Go in, find out how to get in touch with her. Is she too far away? We may have somebody in your area. If we don't have someone in your area and you find them and you know that they have this background, let us know. We'd like to get them into the Wellness Village so that others can find them. I think this is one of the most incredible helps, the most incredible therapies that can be a part of your life if you have Parkinson's or if you have TMD, to find out that what you have, and to, again, let's not leave any stone unturned. Do you have anything else you'd like to add, Dr. Maryam?
No, I just learned something new this week, that if you, and I'm trying to teach that to my kids, you never say, I cannot afford it. You say, how can I afford it? When you put that question like that, you will figure it out. Because unfortunately, if orthopedic retainers were inexpensive, it would have been inexpensive. But it is not just my expertise, but these are costly products that are being made personally. They're not the TMJ appliances that you get at your general dentist. They're not the $500 night guards. These are specially articulated with the machines and computer system to bring your jaw in that perfect position.
Well, so
it's a little bit more calculated, huh?
So let me ask you, can you actually be harmed if you get the wrong kind of appliance, or if you just get one?
Absolutely. I gave a lecture in 2014 to UC Irvine, to neurologists and dentists, that we talked about if a patient has a sleep disorder or TMJ, which they always do when they go to their dentist for guard because they're clenching and they're grinding. When you make what we call flat splint night guard, it actually closes your air pipe 30% more than if you didn't even have anything in your mouth. So for me, we make about maybe 100,000 of them last year in US, if not more. And all we're doing is we're protecting the teeth from wear, but it actually pushes your jaw further back. So that's very important for people to question. When patients come to me, they say they already have guards, they already have night guards, but they're breaking through it. Well, the reason you're breaking through it is because it's done wrong. You need an orthopedic appliance, which shifts your jaw in a new position. So consultation doesn't cost much. I know here in my office, the consultation is $220, includes the x-ray, which is a $400 value. So I think it's worth to have a consultation.
I think so too. So I just want to say to our audience first how proud I am that Dr. Maryam is with us today. Pay attention to the invitations to our village meetings, because in the fall, when we resume the village meetings, we'll have Dr. Maryam on as one of the speakers as well. There are a couple of other dentists that we're going to try to do some of these 5 to 15-minute things to know right now. So I just want to say, Dr. Maryam, how proud I am to have known you, to be treated by you, and C, to know that you are willing to give to our community, which is so important and close to my heart. Your talent and your ability to help them with the greatest quality of life that they can achieve. And that's all we're after, is until a cure is found, we want quality of life. So Dr. Maryam, thank you so much for today. To you, the audience, pay attention to our website, watch our YouTube channel, and just get to know us in the Wellness Village a little better, and we'll just keep working on your behalf to find really good things that can make your life better.
Thank you, Joe, for having me here.
You're welcome.